Well, good morning. My name is Bob Lutz. I'm your county health officer. And I want to talk about where we are today and after the governor's proclamation last evening, his stay home, stay healthy order. Individual behaviors remain the best option for slowing the spread of the illness. Spokane County currently has 33 cases of COVID-19. This number will continue to rise, but I do believe we have the ability to slow the rise. The governor's order of stay home, stay healthy is about limiting unnecessary contact and emphasizes the importance of social distancing. What does this mean? It means no gatherings of any size outside of your household. This doesn't mean you can't socialize with your family at home or at the park. Again, social distancing. Limiting your activities to what's essential. Well, what is essential? Working for a business or an agency that is considered essential by the state. There are many, and they will be posted to the Spokane COVID response website. Healthcare needs that are essential, such as emergency services, going to see your physician or provider, dentists for emergency procedures, midwives, social workers, all of these are considered essential services. Activities that allow you to stay not just physically, but mentally, spiritually, and emotionally healthy. Again, stay at home. I want to emphasize to you and everyone that our community can slow the spread of this illness through these practices. It takes all of us participating for it to be successful. Remember, you may be healthy and unconcerned about the symptoms, but the people you come in contact with or the people who have loved ones are high risk are relying on you to take precautions to not spread COVID-19, which includes social distancing. Again, stay home. Remember, fundamentally, the governor's order is not telling you to do anything different than what we have been asking you to do for weeks. Breathe, just not on each other. Social distancing does not mean social isolation. Find ways to connect virtually with friends and family. Take care of yourselves, take care of others, be kind, be compassionate. Stay home, stay healthy, save a life. Thank you.
Thank you, Dr. Lutz, for your continued guidance and leadership on this issue. I'm Nadine Woodward, Spokane Mayor. And first off, I just want to say that we are inland strong. We are an incredibly resilient community, and we have been preparing for this for a long time now. That plan is continuing to change, it's continuing to evolve, and we fully support the governor's stay home, stay healthy order. A lot of people are asking about what is essential, what is non-essential. Businesses are calling in regularly, and I would just say that there's a full list at SpokaneCOVIDresponse.org. In fact, I believe it's up to 14 pages now, and anything that is essential could be considered a company or a business that provides services or products that are critical in the fight against COVID, or any service or business that supports its community. I think that's probably the easiest way to define that. But again, that list is growing, and please go to that website to see if your particular business falls under that. I just want to let you know that we have a plan, and to give you an idea of what we're doing collectively, not just the city of Spokane as I speak for the city, but also our region. People ask about food. What are we doing for those who are food insecure? And we have Greater Spokane Meals on Wheels. I just got an update from them. They have plenty of meals for our seniors and our elderly. That's a vulnerable population. Many of them are shut-ins. We have meals for them. Food banks. The Second Harvest Food Bank, Northwest Food Bank, has been providing plenty of food. There is no food shortage. Just got an update from them as well. They are changing the model of how they deliver food right now, and they are packaging everything so that there are fewer hands on the food that people receive. That food is then going to individual food banks There is no shortage of food for those who are vulnerable. In fact, if you don't know where to go in that area, excuse me, call your community center, because they have the list of all the food banks that are providing food. And our children, a lot of, I'd say in the Spokane School District, nearly 60% of our students rely on 2 meals every single day, breakfast and lunch. And the Spokane School District has just added 3 more sites for drop-off meals to children. They are up to now 24 sites that they are now delivering food within the city of Spokane for Spokane public school students. There is a question out there about volunteers. A lot of our volunteers are the ones who provide the Meals on Wheels, food to the food banks. They are, even though they are volunteers, they are considered essential workers. So if you're a volunteer that helps in this effort, just know that we still need you. And then looking at our vulnerable populations, shelters. With this directive from the governor, our shelters will now transition into a 24/7 shelter. And so we are assisting those shelters as we speak in order to do that. That will require more staffing. And as you probably have already heard, we've announced this before, that our downtown Spokane library, the first floor, will be a new shelter space. We hope to move in by the first of the next week, and that will provide initially 100 new beds and up to 140 beds. We are also looking at other sites as well. We were looking at the pavilion at one time in Riverfront Park. That doesn't look like it's going to be an option, but we are in the process of assessing beyond the shelters for the homeless, isolation and quarantine spaces, and we are looking at, oh, thank you. Let me take a break for a second here. We are looking at the fairgrounds. And let me just say that when we assess these buildings, it takes time to do that. We have to think of everything that is involved in staffing, in space, in transportation to get people there. But we're looking at the fairgrounds as a possible, and it looks like it's going to work, isolation quarantine facility for numerous populations. Those who are homeless, those who are healthy, those who are discharged from the hospital but can't go home. There are a number of needs there that we are meeting. I just want to thank the staff, not just at the city, and they're doing an incredible job. I cannot tell you the work that they are doing is, I am so amazed and I am so inspired by weeks worth of work now. And now that we're here at the Emergency Coordination Center and working regionally with our partners, the work that is going on here, 12 plus hours a day, every single day, so that we can respond to the needs of our community is absolutely inspiring to me. And I can't thank enough the people who are here, the ones that are working behind the scenes that you don't get to see every single day that are in this effort. And it just is an illustration that this community is strong, we are resilient, we will come together, we will work together, and we will get on the other side of this together. So thank you for being here.
Hello, I'm your Spokane County Commissioner, Josh Kearns. I just want to assure you that this is a team effort. Our healthcare, our government, our business, and our community organizations are working together to keep our well-being strong in this community. Our local experts are working long hours each and every day to assure that this community remains healthy, safe, and inland strong. But our businesses are being impacted by this, whether it's our rural businesses, our businesses located in the unincorporated county, or in our municipalities. They are being impacted. One thing I want to remind folks that many restaurants are still open in this community for to-go orders and deliveries. We need to support our businesses. We need to keep people employed. That is extremely important. We need to keep our economy going, and we need to do it in a safe manner. But you know, I want to just reiterate: we are a strong community, And one of the things that I really want to emphasize to folks is to make sure any information that you find out there, please verify the source that's putting it out there, whether it be on television or on the internet, on Facebook. But one of the best places that you can go for the most pertinent local information is SpokaneCovidResponse.org. Folks, we are a strong community, and we will get through this together.
Hello, my name is Ben Wick, the mayor of the city of Spokane Valley. Just wanted to also add in that Spokane Valley is a part of this community as well, and this response as a region. So we're doing everything we can do to be a part of this collaborative effort, moving our communities forward. And we know that there's a lot of strain and anxiety that's coming out of this. But rest assured that we're doing everything that we can to move our community forward in a health and safe manner. And so similar to what was said before, our food banks are still open. Spokane Valley Partners is still going to have food for those. The schools are continuing to add additional stops for food delivery for students and kids, as well as Meals on Wheels. If you are a volunteer, please continue to do that. If you are looking to become a volunteer, I'm sure that they're looking for additional volunteers as well, to please reach out to those organizations. Again, the order is to stay home if you can. If you need to get out to get food, please do that though. And also remember to shop local, is what's been said already before. We are one community and one region here, but we need to support each other through these times. Thank you.
Good morning, I'm Kevin Freeman. I'm the mayor of the city of Millwood, and our small cities and towns everywhere in Spokane County are feeling the effects of this illness, making it absolutely critical that we all support our response. We are all working together to ensure that every voice is represented, and we remind you to put your friends and neighbors first by staying local, support your local businesses, support your local shops, stay home, and stay healthy. We as a community, all of us together, will get through this and stay inland strong. Thank you.
Good morning. My name is Andy Billig, State Senator from the 3rd Legislative District and the Senate Majority Leader. And here today in support of our regional, state, and federal coordinated effort to this outbreak. And it's really in times of crisis that you see people come together to solve problems and to support the community. And I think this is really quite remarkable. And it's not just today that we've come together, but every day that this team of local, state, and federal partners of working together. It's also a time of bipartisanship. With the governor's order last night, the 4 leaders of the legislature, the majority leader, myself, the Speaker of the House, the Senate Minority Leader, and the House Minority Leader all came together to issue a joint statement in support of the governor's stay home, stay healthy order. That is fairly unusual to have a joint statement like that, but it helps to demonstrate the unity that we have as we fight this challenge. You know, this is a challenge from both a health and an economic standpoint, and I know that both are causing anxiety and real impacts. We need to listen to the orders from the governor and from Dr. Lutz and the other professionals that are helping to lead this effort. And together, we'll get through it. And I want to say a special thank you to the professionals that are leading this effort. Dr. Lutz, who our county health officer, Secretary Weissman, the State Department of Health Secretary, and all of the frontline public health professionals, the first responders, the healthcare providers that are keeping people safe and helping people to recover, and all of those keeping our society going, from the grocery workers to the truck drivers to everybody that has come together as a part of this effort. This is probably the most challenging situation that most of us will face in our lifetime as a community. But Washington is resilient, Spokane is strong, and together we'll get through it successfully. Thank you.
Hello, I'm State Representative Marcus Riccelli. Just here to emphasize what others are saying. We need to come together as a community, and a lot of our people are struggling these times. It's tough. We know that people are being impacted financially. It's important in these times when people are staying home and staying healthy that we also make sure that we're still helping people to get their basic needs. And I want to thank the mayor for bringing up the food security issues. I think that's important. We're standing strong together to make certain people have a home to stay healthy in, and again, food in their belly. I think that's really important. I want to echo Senator Billig's comments. I really appreciate the work being done on behalf of our community to keep us inland strong. I'm working with my colleagues in the House to make sure Spokane's interests are represented. And I want to mention that I'm working together. There's folks in the room like Representative Volz from the 6th District. I just got off the phone with Representative Maycumber from the 7th District, my seatmate Representative Ormsby. But you can see how many folks are coming together to make sure that we're inland strong. And I look forward to continuing this very collaborative effort to make sure that Spokane citizens in our region is looked out for. Thank you.
Good morning, Sheriff Hazy Knezovich. First of all, we really appreciate the work that everybody in this room is doing. And most importantly, we appreciate all the volunteers that have called in that want to volunteer and help their community. That's what Spokane is all about. That's what Spokane has always been all about. We've had some questions about law enforcement. Law enforcement, fire, EMS, we're all out there still doing our jobs. We are not going to take efforts that are going to be draconian on this, folks. We're going to educate you. If we find you in large groups, we're going to stop and go, hey, look, we really need you to comply with these orders. The education part is where we're going to stress our efforts. We need you to comply, though. We need you to take that seriously because it really depends on your family's health. Your elderly family's health are at risk here. We're trying to drive home a point that this is serious, and we need you to do everything you can to follow these directives. We're not saying that you can't go outside of your house. You can. You can go for a walk. You can go for a run. You can bike. You can go to the store, shop for your groceries, go to the pharmacy. There are no road restrictions. That no one's ever mentioned that, but that is one of the common things that we keep hearing. There are no road restrictions. We're not going to be out there like a hall monitor looking for passes. That's not going to happen. But if we see you gathering in large groups, we are going to remind you not to do so. And we're doing it to protect you and your family. So that's what you can expect from law enforcement here in Spokane County, is to educate you, to remind you, and to get you to voluntarily comply with what needs to happen here. We need you to do that. One of the other things we really need you to do is stop the panic. We truly need you to stop the panic. We need those supply chains to reboot, and they're doing their best they can. Everybody I've talked to has reassured me, Sheriff, there is no shortage of anything if people would just go back to their normal buying patterns. If we would just simply do that, the store shelves restock. But as long as you panic, as long as you're in this mode, you're going to see shortages. The minute that stops, so what I'm telling you folks is you're in control here. You control the future of this community in certain realms. You're the ones that are in control. We can give you every recommendation in the world, but if you're not going to heed those recommendations, then you're still going to see shortages on the shelves. You're still going to see case numbers continue to climb. Now, if you listen to what Dr. Lutz has told you, you follow those directions, you maintain your hand washing protocols, you keep that social distancing, we're going to get through this, and we're going to get through this fine. I've said it before, every generation has their challenges. Well, guess what? This is ours. This is our challenge. And how are you going to be remembered? Are you going to be remembered as the great generations before us who survived these things and move forward, as we always have? That is our legacy, folks. That is who we are as a nation, as a community. We don't run from a problem, we face the problem, and we solve the problem. This one's on you. This is truly in your court. We're asking you to calm down. We're asking you to comply with the recommendations. And most importantly, we're asking you to protect you, your family, and your friends. That's what this boils down to. We need you to protect you, your family, and your friends. We're out here, we're doing our jobs. We will protect you. We will make sure that things are done correctly. Our business community, they're stood up. They're trying their best to make sure that those jobs are protected. So you have a job to come back to. We are working very diligently on those issues because it's not lost on us. It's not lost on us that this has an impact on the most vulnerable people in our society. That is not lost on us. So we're working very diligently to make sure that you are taken care of. The health district is doing everything in their power to do so. We have great partners from the state that keep us updated all the time. Senator Billick and Representative Riccelli have been great partners keeping us in tune with what's going on at the state level. The city of Spokane has great teams working many different issues. The county is making sure that we're covering the financial pieces of this because that's what we do. We coordinate the resources for the response. So you have great teams out there working hard for you. We're asking you to do your part and work hard for us. Work hard for your families. Social distancing, hand washing, but I'm going to reiterate, there are no road closures. This is not a hall pass monitor situation. This one's on you. We're out there to remind you to follow the guidelines that have been given. Any questions?
Evictions have been stayed for the foreseeable future, but what if someone is squatting? Can they still be evicted?
You'd have to define that a little bit. If that's trespassing,
Yes.
Trespassing is not an eviction issue. You're on somebody's property and it's illegal to be there. So we're still dealing with that. That's not eviction. We have stayed evictions till May 27th. The only people we're removing from homes right now are those who end up with protection orders against them or restraining orders. Then you are removed from the home. But if you're trespassing on somebody's property, that's not an eviction. That's a violation of law. So yes, we are going to deal with that.
And another question as well, who should people call if they are concerned that the restaurant business or people are breaking the stay-at-home, stay healthy order?
You know, if you would call Crime Check, report those. We're going to ask Crime Check to correlate all those. So we have a list of businesses that we need to go around to and remind them to comply with these orders. I know that Dr. Lutz has a few businesses that have been less than cooperative. If that continues in that status, we'll go out and make our case to them. But the bottom line is we need them to comply and we need them to do it right. Eventually, are we going to have to maybe issue a ticket to that or even look at pulling business licenses? Those are all the options on the table that we don't even want to get there. We don't want to have to do that. That is not what we want to do. It's really, like I said, the ball is firmly in those businesses' courts at this point. They can either follow the directions or we're going to have to take steps to correct that for the safety of the community.
And another question as well, you hit on this a little bit ago. Who will be enforcing the governor's stay-at-home, stay healthy order? Would it be law enforcement or will it be more than just law enforcement?
There's a lot of misnomer about this enforcement aspect of stay at home. There's nothing for us really to enforce about that unless you're forming large gatherings. The order doesn't say that you have to lock your doors and not go outside. That is not what the order says. The order says we're recommending that you, for the safety of you and your family, you restrict your exposure to other people as much as possible. You can still go outside, you still can go for a run, a bike ride, and everything else. You just can't congregate. That is, you can't do that. You can go to the grocery store. You can go to the pharmacy. Those essential business functions are still up and operating. So when it comes down to this enforcement, we're expecting you to enforce that yourselves. We're there to remind you. We are going to guide you in that direction. But if you really push it to the point where we have to do some kind of enforcement, I guess we will, but we shouldn't have to, because again, this is not a hall monitor situation that you don't have to have some kind of pass to leave your house. We're just asking you to make sure that you're restricting the gathering aspects. So this isn't an order to stay in your house. It's a recommendation to stay in your house. You can still do essential businesses, but we do not want any large gatherings.
I have a question for Mayor Woodward. Just to touch on the new homeless shelter, so that's going to be just for this portion of the stay-at-home order, or how long do you see that being used at the library?
Probably at least through the middle of May is what we're looking at right now. And we're looking at more facilities as well, because we assessed that just with social distancing measures being implemented in the shelters, that we would lose about half of our beds. And so we are working with our vendors, our partners that are providing those shelter spaces right now, so that if they see overflow, we can accommodate them in the downtown library.
And you mentioned the hope is for all shelters in town to be 24 hours?
That's what the new order will direct them to do, to operate in a 24/7 situation. Yeah.
And so with that said, how is the sit-lie ordinance going to kind of be enforced? Still the same?
I don't see any changes in that right now. Yeah.
And just one more for you, just to emphasize, no shortages on anything at the grocery stores. Everything is still just fine, correct?
As long as we allow them to stock the shelves, I think. I echo the sheriff's plea to our community, and that is not to get involved in the panic buying that we've seen in the past several weeks. We have to let the system work, and the system requires us to allow time for store shelves to be restocked. In fact, I've seen a lot of people who have been laid off in other positions in businesses. They're now being employed in grocery stores just to keep the shelves stocked. So let's just let the system work and calm. I think it's the calm, it's the courteous, and it's the cautious. We call it the 3 C's. Be cautious with your own behavior, social distancing, washing your hands, proper cough and sneezing etiquette, staying home when you're not feeling well, protecting yourself and protecting others. Courteous, looking out for your neighbors, being kind to people. This is a tough time. Sometimes the psyche of pandemics make people do things that they wouldn't normally do. Be kind. And then being calm, staying calm. We've got a plan in place. We've got all these people in this center working every single day to make sure that we're taking care of our own communities and collectively as a region. So like I said before, I'm proud of the work that's being done here. We're all in this together and we're all working through it together.
Question for Sheriff. We've had viewers asking on the neighborhood side of things, concerned about seeing kids still outside playing. So on the residential side of things, what can folks do in their neighborhoods if they're seeing this gathering continue? I know we've seen neighbors even collectively gathering. At this point, if they see this still happening, what should they do? Is that another crime check sort of call?
Absolutely not. It's time for parents to be parents. That's the biggest takeaway for this one. It's time for parents to be parents. It's time for them to give guidance to their kids. We're giving the guidance to you Now it's time for you to step up and be the parent. And quite frankly, parents, you need to be good examples. You can't be the ones bringing the gatherings together. You've been given the instructions. We need you to maintain social distancing. We need you not to gather in large groups. So, no, this is not call 911. This is not call crime check. This is parent, time to step up and be a parent. You need to be that guiding force right now. That's what we need from everybody. Today, I'm putting some of the responsibility back on my community to help us get through this. We all have responsibilities here, folks, but this isn't one that Big Brother is going to be able to solve totally for you. We rely on the community to step up and do their part, and that is maintain your social distancing, maintain all of the protocols that Dr. Lutz has mapped out. He is not giving you these briefings just to give you briefings. He has given you heartfelt guidance on how to protect you and your family. So parents, this one's on you. You've got to control that aspect. This isn't for one of our deputies or a city police officer to come and fix. Now, if we see large gatherings, we're going to drive by and hey, remember, break it up a little.
I realize we're taking this one day at a time. You mentioned if we're pushed to enforce, I guess, what is that tipping point? What will be the tipping point to start seeing a bit more strict enforcement?
I think the tipping point will be at the business end if we show up, more than 3 times. Matter of fact, I'm kind of a rule of 3 guy. We'll give you 2 warnings, and the third, no more warning.
For businesses
For
as well
businesses.
as public citizens,
No,
private citizens, rather.
we shouldn't unless this is a game day that's going to happen every day, we shouldn't see that. But if we see a large gathering, we're going to recommend that it gets broke up. It'll be a little bit sterner recommendation. But the last thing we want to do is have to arrest people over this, because where are we going to put them? I mean, think about that. That's why this one's on back to the public. We need your help and your compliance, because we do not want to arrest people.
So 3 times, and then what?
Then we're having those discussions. Do we give them a citation? Is that really going to solve the issue? Or do we ask the courts or the licensing authority to pull their business licenses? I mean, that's what we're contemplating. That's what we're talking about. And we're doing the research on all those avenues right now. I'd rather not get there. I would rather not get there. Everybody wants to talk about road restrictions and everything else, like Big Brother's really going to do any of that. No, we have no intention. But we are asking you to please listen and follow these guidelines. That's what it is. And media, I'm going to tell you right now, you can keep asking that question and you're going to get the same answer. We are going to do our best to work with our community, not punish the community.
You mentioned some businesses have already been spoken to.
Dr. Lutz has had conversations with a few businesses. If those conversations keep trending the way they are, then we're going to have to step in. We're going to have to take the next step. So yes, we do have some businesses that have not followed the direction, and we will work with them, trying to convince them to do so. If we have to take enforcement, we will do so.
Sheriff, can I have one thing on that? So I want to say too, backing up our law enforcement, if our law enforcement is spending precious time visiting these entities 3 times, et cetera, they're not being good partners with the public. And so we need to make sure that message is known to the broader community, that those folks who aren't following the important rules in place to keep us healthy and keep our community safe, that they are wasting valid resources and time, and that's a strain that all these people who are working around the clock can't afford, and our community can't afford right now.
Question for Bob Lutz. You mentioned kind of before all this how we're trying to flatten the curve. So based on your assessments, do you think that's happening right now with these new orders?
Yeah, so the new orders are put in place to do just that. I think if I were to look right now at our local numbers, we're not flattening the curve. And I think if you look at it from a state level, we're not flattening the curve yet. So we've incrementally had to increase what we call the non-pharmaceutical interventions to the point where we are right now. The hope is that we'll be able to do so. And oftentimes in being able to see that flattening, we may have to wait on the order of a week, 2 weeks, 3 weeks, 4 weeks. So time will tell. But I think, again, the fact that we have been encouraging, at times requiring, and then having to go to this next step indicates that collectively we've not really followed through with what public health has been providing as recommendations.
Do you know how many days out we could be from the peak of this outbreak here in Washington?
It's really tough to say. I mean, again, you certainly have international models. And if you look at some of the countries where, again, truly they were very aggressive at both the social distancing as well as the testing and identification of individuals who were infected, then again, you see some success stories there. Conversely, you see other communities and nations that have not been as effective. My concern is that unless we really start to ratchet this up in a significant way, we're going to be one of those countries that does not have a slow flattening of the curve. We're going to be doing this for a while.
Now, on the flip side, we saw the last Sacred Heart patient released. Some people are wondering what you guys used to treat those 4 patients that were transferred there. Kind of those methods.
Time.
Any specific medicines?
Time. I mean, honestly, they were diagnosed. They were not symptomatic when they came. They were not symptomatic during their duration, but they met CDC criteria that required them to be maintained there. Time.
And last one for me. State of the hospitals right now, we still have no hospitalizations based on these confirmed cases. Along with that, what do the ICU beds in town look like? Not any specific number.
So a couple different questions there. We actually have had some individuals hospitalized. I cannot talk about their status at this point. With respect to our capacity, that is, again, a daily and hourly number. I'm very reassured by the fact that, as you probably know, Governor Inslee brought to assist the state a vice admiral who has a lot of experience in this work. And I think her guidance, with the collective support of all the healthcare organizations across the state, will really provide us a great opportunity to get in front of the situation, which unfortunately is not what's befallen the communities on the west side of the state.
Do you know how many exact hospitalizations so far?
No, I don't. I'm sorry.
And nationally, we're starting to see this affect younger people a little bit more now. Is that something we're seeing here in Spokane too?
Yeah, with respect to who it's affecting, I think the thing that I have tried to emphasize over and over again is that this does not discriminate by age for the most part. So I can have young people, I can have those 20 to 29-year-olds, I can have those 30-year-olds who may indeed be infected, they just may not be symptomatic. So I think, if we look at it at a national level, no question, based upon who has been tested, those individuals who have been tested are, again, typically older. But again, the data demonstrate that people in their teens, people in their tweens can also be infected.
Dr. Lutz, quick question for you. In terms of PPEs, is there a shortage here in Spokane County, or is there a stockpile on its way to the National Stockpile Center?
Yeah, so certainly PPE, personal protective equipment, has been an issue at both the local, the state, and national levels. It's obviously on the news on an hourly, daily basis. Locally, again, as I mentioned to you, I think that we are in a good position, but not a great position. I think acknowledging what's happened elsewhere, we've been very proactive, we've put in requests. But by the same token, I think that the healthcare organizations, EMS providers, we are very concerned about the possibility of not having sufficient numbers and amounts of PPE when we get to a tipping point, for example. So I think we are in sort of what's called a contingency mode. We're preparing because we want to ensure that we have enough if the situation is required.
And a lot of people are wondering, when we do get a confirmed case, you guys say you're reaching out to everyone they've been in contact with. Obviously, that's really hard to do because I don't know where I was 2 weeks ago. So how do you kind of follow that trail of where they've been?
Yeah, so as part of what we call a contact investigation, what we do is once we have a confirmed case, we contact that individual, talk with her or him, and kind of get a sense of who else they've been around within an identified period of time. Based upon that, that then obligates additional questions, additional phone calls, what have you. So I think the thing that people need to realize is that this is a burden on everyone. My staff have been incredibly busy as this is ramped up, supported by the Department of Health. So this past weekend, the Department of Health said that it will provide additional resources for us to do these contact investigations. What that allows us to do is to focus on those situations where we have deemed high risk. So in your nursing homes, in your long-term care facilities, in the homeless shelters. Those are populations which for us are high risk, and therefore we can put our staff into those situations where, again, one contact may beget a number of cases. And the Department of Health will therefore do a lot of those other contact investigations for us.
Just to confirm, you said 30 cases now?
33 as of this time.
And our final couple of questions are going to come from the folks at home watching live right now on our screen. One of them is asking about an update on our screening site, how that's going out of the fairgrounds, and what folks need to know potentially going there.
Sure. So with respect to the screening site, I think there was definitely some miscommunication, and I will take the onus for some of that. I think early on, because of the concerns that we had limited amount of testing resources, the concern was that if we literally said, come all, come one, come all, that's what would happen, and we wouldn't really be able to test the individuals who maybe really needed to be tested. So the messaging was that you needed to talk with your provider, and that's oftentimes done virtually or by phone call. A lot of the organizations have hotlines, and so you can call a nurse, you can talk with a provider and actually find out whether or not you met certain criteria to be tested. That would then have you go to that drive-in site located at the fair, be evaluated. It wouldn't necessarily require you to be tested, but out there they would make that determination. Over the last 5 days, what we've seen is that people are starting to see this as a great resource. And so yesterday, for example, more than 300 individuals were actually seen out there. Not all of them were tested, but more than 300 cars drove up to be evaluated. Over the weekend, about 150 on one of the days. So it's a great resource. It's a great resource to, if you will, decompress clinics, urgent cares, and emergency rooms, because we want those sites to be available for other people who have more pressing needs. And so this site is a great resource for the community, and again, reflects a collective effort by Providence, by Multicare, by Kaiser Permanente, and Chaz.
This question is for Sheriff Knezovich, and this will be our last question from our Facebook Live audience. We're still getting quite a few questions about transportation, perhaps specifically about the transportation between the Washington and Idaho border. Could you touch upon that, and also maybe the concept that's going out there about needing to have documentation from their employer about being an essential business when traveling? Just touch upon it again.
I can, and I'm going to stress this as firmly as I can. This is not a hall pass situation. You do not need documents to travel on the roadways on the state of Washington. That is a Facebook myth, rumor that was started by people that like to cause chaos. That is as firm as I can be on that. You're listening to the wrong sources, folks. You are listening to the wrong sources. You have people on Facebook that love to spin things up, and that's what they do. I've heard it all, that we're going to, that there are communities banning the sale of guns. I have yet to see that happen. There is no restrictions on the roadways in the state of Washington. You can go to work, you can go to the grocery store, you can go to the pharmacies without a note without a pass, without anything. The corridor between Idaho and the state of Washington remains viable and unrestricted. So please, check your sources. If you're not hearing it from a credible source and it's coming off of Facebook, odds are it's probably not true. And quite frankly, a lot of the runs on items at the stores that we're starting to see are driven by somebody started something on Facebook, and next thing you know, you can't find that item anywhere. So that's where that's coming from, Jared. The truth of the matter is you have people out there giving false information, misinformation, and we keep, as a public, sucking that up. Stop. Really think about what's going on. If there was such a directive, do you not think I'd be up here telling you that that's the directive? Have you heard those words coming out of my mouth? No. What have I said? I have said there are no restrictions. You can go back and forth to work. You can go to the grocery store. Those essential functions are up and viable. What we are asking is simply, if you can stay home, stay home. If you have to go to work because you're part of that essential function, well, then you go to work. It's just that simple. But we have to start, quite frankly, I think that Marcus is right. I think we need to start calling out some of these people that are causing this havoc. And let people know this is where it's coming from. This is really where this rumor started. And maybe it will make them think twice about starting those type of rumors. So definitively, no restrictions on the roadways in this county, in this state, or between the states. There are none. The day that that happens, I'll be the first one to tell you. So until you hear me say it, it's not happening. I don't foresee it happening. Thank you.
Just to clarify, if you violate the order, is that considered, as far as citations go, a gross